Hello everybody and welcome back. Today we're going to continue talking about potassium currents and the mechanisms of potassium. We're going to talk about how G protein activates the potassium currents and how the ATP is sensitive to potassium channels. So now we're going to talk about the G protein activated potassium currents. There are a series of steps for activating the potassium currents due to the G protein. The first step is by the vagal stimulation of the sinoatrial node and the atrioventricular node. Then it goes to the acetylcholine, the neurotransmitter. Then it goes to the muscarinic receptor of the acetylcholine. For the acetylcholine, it has two receptors, the nicotinic receptor and the muscarinic receptor. Muscarinic for the heart and nicotinic for the neuromuscular junction. So for this case, it's the muscarinic receptor. Then G protein binds to it, the beta and the gamma subunits. After it, the potassium channels open and potassium current goes outward. Which causes hyperpolarization. Then this causes a slow pacemaker rate and slows the action potential conduction through the atrioventricular node. So it slows down the pacemaker rate. So these were the steps for the G protein activating potassium current to slow down the pacemaker rate. And now we're going to talk about how potassium channels are sensitive to ATP. Potassium currents are depending on ATP and ADP ratio in the body. A decrease in the level of ATP and an increase in the level of ADP cause potassium channels activation and potassium outward flow. So this was how potassium channels are sensitive to ATP. Thank you very much and hope to see you soon again in the next video.